Welcome to Live Pure, the podcast. I'm your hostess, Janelle Alexandra. Get comfy, settle in, as we discuss all things health and well-being. Be sure to like, share, and subscribe. Now, let's get to talking about living pure. Hi, welcome back. I'm Janelle, your hostess, and today we're here with my friend Rudy Dragone, and he is a compound pharmacist. Rudy, say hi to everybody.
Hi, everybody. How is everybody doing?
Do you want to explain to everybody a little bit about what you do?
Okay, I'll give you a little bit of background on myself. In 1998, I moved out to Arizona after selling 10 pharmacies that I had back in New York. And I loved hormones, so I tried to go to the three top guys in the world at the time was Roby Mitchell, Jonathan Wright, and Terry Herzog on bioidentical hormone replacement. So I was sold on bioidentical hormone replacement because I was always compounding. You know, the person who taught me how to compound was an 88-year-old man, 88-year-old pharmacist when I was only 9 years old.
Wow.
So he was born in the 1800s, okay? And it was funny because we would make suppositories and we would make creams and all these different things. And then when I had the pharmacies, this one lady came up to me and she said, can you make this prescription for progesterone because it helps with fertility? And she had gone to 50 different stores, you know, the chain stores, and nobody makes it. So I said, sure, I'll make it for her, and we made this, you know, progesterone suppositories. Well, 9 months later, she comes in and she goes, hey, Rudy, I want to introduce you to Rudy.
Aww.
And she has this baby in her hand, and she goes, you know, you made this possible when other people weren't doing it. I was hooked. And so I wanted to learn everything I could about hormones, and we did. And I read the books. I went to visit all three of the guys. And I said, got involved with some investors, and we decided to do a company called Profile Health. And we had 21 docs that were working for us. And we had a 28-minute infomercial. We were doing telemedicine back in 2000, okay? Wow. Before anybody was doing telemedicine. And we must have taken care of anywhere between 24 to 30,000 patients. And a lot of those patients just didn't fit into the box of what was written in the books. So we had to come up with our own ideas. And because of it, we were able to, you know, extrapolate a lot of what is now bioidentical hormone replacement. And so I get calls from literally all over the world asking me, you know, what would you do with this? Because it's nowhere in the books how to take care of that, you know, and it's been very, very gratifying. We've been helping really a lot of people. When I get the people when no one else knows what to do with them, and they say, you know, how do we fix this?
Yeah.
And I'll give you for instance, you know, patient came to me and she said, she's crying. She said, doctor said that we had to have a hysterectomy because she's bleeding 15, 16 days out of every month. And now she's anemic, okay? And he's just worried that, you know, she's going to get really, really sick and there's going to have a problem. So I said to her, I go, hold off a minute. I go, let's talk about this a little bit further. How badly anemic? And she was borderline anemic, but the doctor just kept saying, it's going to get worse, it's going to get worse, it's going to get worse. You're going to have a problem. Let's give you a hysterectomy. She's 24 now, understand, 24 years old.
She's never had children.
She's never had children, and she wants to, okay? And the doctor's telling her the best course of action is to have a hysterectomy. And I said, what we're going to do is during the luteal phase of a person's cycle, they make progesterone. And progesterone maintains the uterus. And it needs a certain amount of vitamin D to be able to make sure that the progesterone is working. So I said, what we'll do is we'll go 90 days and we'll increase the progesterone, maintain it for the full 90 days in that luteal phase, suspended in the luteal phase. Why? Well, the red blood cell only lives 120 days. So by sustaining the luteal phase for 90 days, we've recaptured 75% of her red blood cells.
Interesting. So that helped with the anemia.
And all of a sudden, she's not anemic anymore. And now that we were able to control her cycle so that she doesn't bleed as often, we can regulate her cycle. She has 3 kids now.
Wow.
She has 3 kids. Where
were you in 2017 before my hysterectomy?
Well, I've been yelling from the rooftops for decades, and I don't know if you remember. It was in Phoenix, and it was quite a few years ago. This lady had 5 kids, and she had a kid, and while she was pregnant, she was feeling good. But after she gave birth, she was a complete basket case. By her own admission, she was a complete basket case. So she wound up having 5 kids, and at the end of it, she wound up killing all 5 kids.
Oh my gosh.
It was big news, and I was yelling from the rooftops, check her progesterone. You know, check her progesterone, check her vitamin D, make sure progesterone is active. Progesterone binds to the same nerve centers of the brain that Valium does. It's the body's own natural Valium to calm a person down.
And this isn't just women. Men also produce a little bit of progesterone as well, and that helps them establish their testosterone.
That right. Progesterone
I
fights
did my homework.
Progesterone fights against testosterone. Progesterone fights against estrogen. I shouldn't say fights. I should say balances. Okay, it's the yin to the yang.
Yeah.
Okay, I'll give you a quick story. We had a volunteer, and there was a group. I don't want to tell you which group of people they were because they're civil servants, and they were saying, whenever this person drinks a lot of alcohol, they want to fight everybody. And this was a pretty burly guy. I mean, the guys that have like hair on top of their shoulders type of burly guy. And everybody knows it. And he knows it too. And we said to him, we said, you know, you want to fight everybody because when you drink a lot of alcohol, it changes your testosterone to estrogen. And now you start to PMS. So as a male, you start to PMS, and this is what makes you so irritable, and this is what makes you want to fight everybody. So I said, if you're willing, okay, we'll put 100 milligrams of progesterone as a cream on you when you get to that state. And he signed off, and they did it, and they, you know, this is with the doctor there, and so on and so forth, and we got him drunk, and sure as anything, he started fighting everybody, and they held him down, they put the progesterone on. And within like 20 minutes, he was like, I love you, man. I don't want to do that to you. And I mean, there was a chief of police. I don't want to tell you what city, but there was a chief of police, and he looked at it and he said, wow, we should have this in the squad cars. We should be, you know, come to a domestic, you know, dispute and put it on the woman, put it on the husband, let them sit in both squad cars for 20 minutes, and then they'll hold hands and go back inside.
What a misconception that is, because we always assume that person is raging in testosterone, and that's not necessarily the case then.
No, it's not. It's testosterone, when it's really, really high, okay, can make you antsy, okay, but for the most time, when you have a lot of testosterone, you'll see a guy that really is very quiet. And he has more of a I don't care attitude. Mm-hmm. You know, it's like, oh, the house burnt down, I'll build you another one. That's high testosterone. I give this little story. It's about my dad. You know, he's passed away now, but years and years ago, I was a kid. I was only 9 years old. And I didn't realize all of these things, all these stories that I'm telling you, until I became what I have with the hormones, okay? But at the time, I walk into the house and I said, this is in the Bronx. And I walk in and I go, Dad, there's a car on fire outside. And he looked at me with a real Italian attitude. He goes, is it your car? And I said, of course it's not my car. I was 9 years old. And he goes, what do you care? You know? and that was fine. You know, that left it. Fast forward 30 years, okay? I go to visit him, and he's outside the house now. Okay, it's 3 o'clock in the afternoon, and I go, hey, Dad, what's the matter? And he goes, there's this woman. She comes over, and she's got a boxer, and the boxer goes right to that fire hydrant, and he does his business right on the fire hydrant. He'll poop right on that fire hydrant, and then I have to go and clean it up. The man who couldn't care less if there was a car on fire, high testosterone, okay, now is worried about dog poop, high estrogen.
Interesting.
And I'm sure a lot of people listening to this was going to say, you mean like when my husband comes over and says, why are the lights on? Why are all these lights on in the house? Who's paying for this electrical bill? Why is the AC set up at 68? It should be at 74 or 75. Who's going to pay for the extra electricity? It's not that much money. But what happens is, as the testosterone goes down, the invincible attitude that he had when he was younger, that he could be able to conquer the world, it's not there anymore.
Oh, fascinating.
So now he's worried about, do I have the strength to work, to make the money, to pay that electrical bill? Let's not waste it, because I don't have it in me like I used to. A man loses 2% of his testosterone from age 25 on every year. So by the time he's 50, he's half the man he used to be at 25. By the time he's 75, he's none of the man he used to be at 25. And
Pay attention, gentlemen.
I mean, we make a joke out of it, but if and it's funny because you have circadian rhythm. So between the hours of, like, say, 11 and 4 in the morning, that's when testosterone is the highest. And then it dips down, comes back up around 10:30, and then it dips to the lowest part of the day around 2:30 in the afternoon. All you have to do is go to the nursing home at 2:30 in the afternoon, or have your elderly relatives come and visit you and see what happens at 2:30 in the afternoon. They're all sleeping. Everybody's taking a nap. Go to the nursing home. Everybody's out. Why? Low testosterone.
I like to take my naps in the afternoon.
And that's the men. And then the problem is that, like, again, men lose linearly about 2% a year, and it goes pretty straightforward. But with women, you have this undulating problem every single month, and then you go into perimenopause, and it's a bigger problem, okay? And then you go into not menopause, where it goes all the way down to nothing, and you have nothing. And I try to explain it to people, and I go, it's so important for the men to be sympathetic to the women. And it's so important for for women to be sympathetic to men.
Yeah. It's almost like we reverse roles by the time we get older.
But it's worse. It's worse than that. I mean, if you ever look at an 80-year-old man and an 80-year-old woman, right? They're the same height. They look more like a couple. They look more like brother and sister than they do husband and wife. Why? Because for about 15 to 20 years, they have no hormonal function of their own. But they're sitting across the same breakfast table, the same lunch table, the same dinner table, ingesting foods that have chemicals that act like hormones. And they're ingesting the same foods, and they're basically becoming the same person.
Oh,
okay?
Fascinating, yeah.
And I've done it. I've sat them up and I said, let me look at the brown spots on your arm. Let me see the size of the nose. Let me see the size of the ears, and they're identical.
I know. When you came to my door to drop off those books that day, you had me pegged for like 3 different physical things within 30 seconds of seeing me, and I was like, okay, my savior is here. So let's. Some of the things that I wanted to talk to you about is, so I personally had a THC addiction.
Okay.
And I've only been off of it for 6 months now.
Okay.
But after reading your 2 books, which I found super fascinating, and I feel like I just need to, I'm a sponge. I just want to keep taking in more information on hormones.
Okay.
Because currently I'm taking a peptide, but I think the hormones are going to be something radically different. And as you know, with Dr. Sabatier, I'm even taking a little bit of stem cell therapy.
Okay.
So I'd like to be able to intermingle all of those things together for my last few doses and really see what that's doing. But what I've understood with some of the studies that I've read personally and just the conversations I've had with you is that THC does some really big damage to thyroid issues.
It can, okay, and it all depends on how much and for how long you use it, okay? So, there are 2 camps. Actually, there's more than 2 camps. There's a lot of camps when it comes to that, because they say if it's a small amount and it's only used at night, it doesn't really matter, and because you're going to be under the covers, and by the time that under the covers, your body is warmer. Thyroid regulates your body temperature. So depending on how much you use, if you're staying warm because you're under the covers, it's not going to make that much of a difference if it's used a small amount, okay? Now, if you use a large amount and you suppress the thyroid function, that could be a big problem.
Yeah,
okay?
and that's what I was doing. But the thing that I think everybody was concerned about is I got adrenal fatigue in 2017.
Okay.
And it took me many years, like 4 years, before I even started feeling pretty normal. But a year after getting that, that's when I had my full hysterectomy. We found endometriosis. There was a lot of issues going on in there. But I had already been consuming THC on a daily basis at this point.
Okay.
And now I look back on it now and I feel that the THC itself, especially the high doses that we have now that it's considered legal.
Yeah, no, what we have now is like
something that actually
ridiculous.
probably
Being
exacerbated
a child of the 80s.
Yeah,
you
where
know?
it was only 1 or 2%. Now we're
Yeah.
at 95% now that it's legal.
it's-
Now I had my medical card and I've started taking it before we became legal. But I have a feeling that now that I'm off of it and I've done more research, that the THC caused my adrenal fatigue on top of all of the other external stimulus and stress that I was under.
There's not enough evidence for me to be able to say yay or nay.
Yeah.
Okay. And
I'm only judging by the way that I know what I feel like and what was taking place in my body at that point.
Now, what I can tell you though is that I have a lot of patients that have had adrenal fatigue, adrenal exhaustion, and I came up with a solution to that. Okay. I talk to people and I say, well, let me back up a little bit. Why is it that we have that nowadays? Okay, we're not meant for a 30-year mortgage. We're not meant for car.
We're not meant to drink 22 ounces of coffee first thing in the morning or throughout the day.
We are living very high-stress lives in the United States. You know, everybody says, oh, the United States is the best country in the world. I disagree. Okay, we're 23rd in healthcare, and when we look at all the stresses that we put on ourselves, I remember days when people used to get 3 and 4 weeks vacation, okay? And they would take it all in one shot, okay? So that you'd be able to decompress and relax. You know, if I took someone that's stressed, okay, and brought them to Fiji and kept them in Fiji for a while and gave them the opportunity for their body to come back, think about it. Our adrenals are 2 sponges sitting on top of our kidneys, and every day when we stress over anything, okay, a bill that has to be paid, a child that has to be picked up from school, whatever, you squeeze those sponges. And by the end of the day, there's nothing left of them. So you're exhausted and you fall asleep. And if you get a good night's sleep, then little by little they fill up. And then you can do it all over again. So when we're younger, it's easier for those adrenals to fill up. But if you're constantly pushing them, and then you go into something like perimenopause, where you're not making the right amount of hormones, and you're not sleeping well, and you have insomnia, so you never get a chance to decompress, and they never get a chance to refill. So now you're at 25% when you're starting the day. Okay? By 12 o'clock, they're gone. There's nothing left of them. Okay?
Yeah, sometimes just taking a shower was all that I could manage for the day.
And I hear it all the time, okay? And it's funny because people don't realize how much the hormones play a part in their day-to-day activity. And worst off is when you get through adrenal fatigue, adrenal exhaustion, and then partial adrenal failure or full failure, that's where people start having the problems with autoimmune disease. And I just recently, I had a patient, which was a doctor, that called me in it was November of last year, so coming up on almost a year. And she calls me and she says, Rudy, I'm going to stop my practice. And I go, why? And she goes, because I was diagnosed with multiple sclerosis. She had lesions on her brain. And there's all these different biologics.
Those are the women
now.
I'm like, get in here, let me get my wands on you.
Well, all these people with they have all these biologics now to suppress the immune system. The immune system goes hand in hand with the adrenals. Now, how do we figure this out? We were thinking about anti-aging. So we were replacing hormones, and there's a lot of anti-aging clinics. So what makes a regular person a hormone expert or an anti-aging hormone expert? What they did, the big secret is that if you look at ranges, okay, on particular hormones, like DHEA is one of them, it says 30 to 330. Well, those ranges correspond to ages. Who's got 30? 69-year-olds, 79-year-olds. Who's got 330? 19-year-olds. And what do anti-aging specialists do? Well, they say they take the bottom number, the 30, from the 330, and it leaves you 300, divided by 3. So the top 1/3 of normal is 230 to 330. And I say 230 to 330, 30-something forever. You'll be 30-something years old forever. If I said to you today, Testosterone builds muscle. Nobody in the audience would say no to that. Everybody knows. You look at all the guys that are bodybuilders.
Oh, when I was taking it, even though I was 90 pounds, I was so shredded.
Testosterone builds muscle. Well, you have more than muscle in your body. You have bones. Progesterone helps build bones. You have connective tissue like ligaments and tendons and all different types of fascia. Okay, who takes care of that? DHEA. And DHEA, helps the adrenals. I've coined a phrase called a chemical vacation. So I said, okay, if you look at a person in Fiji for 6 to 8 weeks, okay, what would happen to them? The DHEA, the vacuoles of DHEA hold it on the adrenals will go up. What happens to the cortisol? Cortisol will go up to normal levels if it was depressed. What happens to pregnenolone? Pregnenolone goes up. So what happens if I gave a little bit of hydrocortisone and a little bit of DHEA and kept increasing it as if it was filling it, if I'm filling it up, okay, and then slowly decreased it? While the person's still working, we're achieving the same hormonal levels that you would as if she was in Fiji or he was in Fiji. And at the end of it, they feel like they've been on vacation while they were still working. Okay, that's what I call a chemical vacation.
Oh, I like
it. And it goes
I'm
up.
ready for that.
And then it comes back. It goes up and it comes back down again. And a lot of people come back to me and say, "Wow, I feel great." And I go, "Now, we did it. We brought you back. You feel great. Wonderful. If you go back to the dog-eat-dog rat race, it's only a short amount of time before it happens again. That's why we're supposed to get vacations once a year, you know."
Or there's other techniques out there, like in my center, we offer what I call lymphatic breath work and movement, so that we're teaching them how to calm their central nervous system just through the breath, which also stimulates the lymphatic system. But
and that's perfect, to have, if you can join 2, 3, 4, 5 different modalities to be able to find your center. I always tell people, I go, pray. I go, meditate.
There's something great about the power of prayer.
The power of prayer, the power of meditation, the power of oneness, make yourself connected with the universe, whatever it takes for you to center yourself, okay? But if we do all of this work to get you back to square one, and then you go right back to the same things that you were doing before, it's only a short amount of time before you'll fall again.
Yeah.
So it's a combination of a lot of different things. Hormones can help, and to me, I look at it and I go, hey, I don't want to tell everybody, you got to eat salad all the time. You got to work out 6 hours a day. That's not life.
I think that's the problem that I'm running into with women my age and older is they are, concerned about this stubborn belly fat, right? The stubborn belly fat that they can't get rid of. And a lot of them are putting themselves in, I think, too much of a calorie deficit, because that's what the stigma still is let's take away all of our calories and starve ourselves, and then we'll burn all of our fat. And I think the thyroid is definitely more involved in there. So the last 2 times I've had my thyroid checked, all the way through the history of having it, since 2017, my thyroid comes back healthy. But then after reading your book and doing some more research, the suggestion is to take our basal temperature in the morning. Mm-hmm. And if it's below 98 degrees or whatever, I'm at 97.1 in the morning.
Yep.
And my monitor today even told me that my temperature was elevated to like 97.5. That's high for what I normally am. And I'm like, oh, God.
it should be 98.6. You hit 3 different points, and I got to see if I can remember all 3 points that you talked about. Number one, and I wanted to stop you as you were saying because I got so much to say, but let's just stick with the thyroid, okay? I am on a crusade to get everybody's thyroid fixed. And I want everybody burning at 98.6. Number one, okay? You talk about belly fat, okay? Everybody has some belly fat, and why does it happen? In the worst case scenario, I find what I call potato people. Potato people are, if you could picture Mr. Potato Head with, instead of arms, put toothpicks on their arms and their legs. Why does that happen? You'll see them. You'll see, especially in the elderly, okay?
Yeah.
A person will stress out. When they stress out, they make cortisol. When cortisol goes up, it causes the muscles on the arms and the legs to actually sacrifice themselves to make sugar. Because the difference between a cortisol going up because you're being chased by a tiger or cortisol because you didn't catch the mailman is exactly the same. Okay?
Yeah, our body doesn't really know the difference.
It doesn't know the difference. So all of a sudden, your cortisol goes up. You degrade your muscles in your arms and your legs. You sacrifice them to make sugar. Okay, the sugar goes up, but you're not running anywhere. And because you're not running anywhere, what happens? The pancreas releases insulin. Insulin goes throughout the entire body, and it says, I got to get rid of all this sugar that we're not running away from anywhere. Two cells have 200,000 receptors for insulin. One of the fat cells, the adipose tissue around the midsection, and the other one is the liver. The liver can only hold about 2 teaspoons of sugar, okay? 10 grams, and that's about it. And then it can't hold anymore.
Less than a soda these days.
and so it bathes the muscles around the belly and the inside of the thighs. So you'll see people that look like they're wearing a down coat with skinny arms and skinny legs, because the fat's just surrounding it. And they're sacrificing their muscles. And some of them are doing it at night, okay, when they don't even know it. They're going to sleep. They're stressing over a bill or something like that. They're not getting good sleep, and they're tossing and turning. And as they're doing that, they're not running anywhere. So they're creating more cortisol, degrading more of the sugar, degrading more of the muscles, and creating more adipose tissue.
And is this kind of the same scenario of people who are putting themselves in severe caloric deficits then as well?
Well,
their body just starts to eat themselves? And
the body, well, if I took a perfectly healthy woman, okay, and she's burning at 98.6, that's what I call them. I said, when your metabolic rate is, and your temperature is 98.6, and we put her in a closet for 3 days. When she came out, her body temperature, basal metabolic temperature would be 95, okay? And because she's not eating, she's starving herself. So the answer to why people will diet and then in 2 weeks they just flatline, they don't lose any more, they'll lose weight for 2 weeks and then they flatline, is because the body says, I gotta protect myself. You're starving me, and I'm going to die. So what do I do to protect myself? Lower body temperature. So if I lower body temperature, then I'm not burning the food, whatever food you're giving me, okay? But I'm protecting myself. It also creates another protein called a steroid hormone binding globulin. So it's called SHBG. As SHBG goes up, it tells me that there's a thyroid dysfunction. So I'll look at somebody and say, oh, the thyroid's in the middle here, in the middle here, in the middle here, but the SHBG is high. There's something wrong. And
is that something most doctors test for when we say, hey, I need my thyroid checked? Do they check for all of those things?
They will test it, but they don't know how to interpret it.
Okay.
Okay.
I wish I had my results here with me.
Here's think of it this way. Think of thyroid as an army. And we have 100 men, and 100 men are going to do 100 jobs. And if we had the full 100 men doing the full 100 jobs, we would have no problem, okay? You're not considered to have a problem until 30 of those men don't do anything. So when you get beyond 70, okay, so you're at 69, then you're said to have a certain hypothyroid problem, okay? If you have antibodies and the antibodies had destroyed 31 of those men, you're said to have Hashimoto's thyroiditis. If you have, those men become reverse T3, was basically too high of something called reverse T3, and it goes down to 69 men are only working, you're said to have Wilson's, okay? So that's the thought. Once you go down to 69 or less, you're said to have a certain disease, and we have to track it. Well, what happens if I have 20 men that have a problem with antibodies? Well, you don't have Hashimoto's. Well, what happens if I have, at the same person has 20 men that are not working because of reverse T3? You're down to 60, okay? You're hypothyroid, but you don't fall into any one of those things where you will consider a disease, and doctors don't know what to do with it.
Interesting.
So I look at it and I say, if you have too much reverse T3 and you give a little bit of regular T3, then all of a sudden, over the course of 2 or 3 months, the reverse T3 goes down, okay? So if I can get you from 20 down to 10, and then I can get this one, most of the times when they have antibodies, is a low problem with other hormones like DHEA because of stress, okay? And you support the stress function, you give them a little bit of that for a couple of months, and what will happen is the amount of antibodies goes down. And so now if I went from 20 and 20 down to 10 and 10, now we still have 80 that are functioning, and now you don't feel like hypothyroid.
Interesting.
So
Okay.
so that's what and why is thyroid so important? And this is why I'm on a crusade for it. I have seen and I've heard so many people tell me, my mother went into the hospital, she got pneumonia, she had a low-grade fever, and she died. I've heard that story, I don't know how many times. It brings a tear to my eye when I hear it so many times. And what's happening is no one's optimizing the thyroid. Why did she have a low-grade fever? When you confronted with an infection, you'll spike a 5-degree fever. So at 98.6, you're at 103.6. The white blood cell does not activate inside of our body until over 103 degrees. So interestingly enough, I was working with a company out in Japan, and they told me, they said, look, we had this ward for cancer, and these people, this whole area got malaria, and the malaria spiked these fevers, and after 3 weeks, nobody had malaria and nobody had cancer. The malaria spiking the fevers activated the white blood cells to a point that it actually helped kill some of the cancer.
Fascinating.
Okay.
I love that.
And
I hate to stop you
Go
here,
ahead.
but we're out of time. But
Oh, I'm
clearly
sorry.
you're going to have to come back because
Okay.
this is an ongoing situation, and I have now a million more questions to ask you, and I'm sure our listeners are going to have a million things to ask now as well. So we're going to have to invite you back so that we can answer some questions. And
Well,
get
I try to
deeper into
remember
it.
where I left off, and we'll continue.
Yeah,
some
you
other
have
day.
been such a pleasure. I'm
Thank
so
you.
excited that you've come today. So thank you so much.
Oh, thank you.
Thanks for tuning in today. I hope you learned something new about health and well-being. Remember, your current position is not your final destination. Be sure to like, share, and subscribe to our channel. Definitely reach out with questions so we can discuss it in a future episode. Until next time, live pure.